Welcome back to the Dr. Jeffrey Tauth Heart Talk Show, and today's show is called Dr. Jeffrey Tauth, the Aspirin a Day Debate Exposed. And trust me, it's juicier than your cousin's peach cobbler. For decades, doctors told us to take a baby aspirin daily to prevent heart attacks. It was like gospel, right up there with eating your vegetables and calling your mother. But new guidelines have millions of people confused about whether they should stop. And let me tell you, my phone has been ringing off the hook. Today we're going to cut through the confusion and tell you exactly what to do. So here's the bombshell that dropped in 2019. Guidelines shocked patients when doctors started saying, "Stop the aspirin. I can't make this stuff up." Studies showed daily aspirin increases bleeding risk, especially in people over 70. The one-size-fits-all approach that we'd been preaching for years was actually harming more people than it helped. The risk of stomach bleeds and brain hemorrhages outweighed the benefits for healthy adults. It's like we'd been giving everyone the same size shoes and wondering why half the people were limping. But here's where it gets tricky, and this is important. People who have already had heart attacks or strokes should absolutely continue taking their aspirin. Don't you dare stop without talking to your doctor first. Adults between 40 and 59 with high cardiovascular risk may still benefit too. Your bleeding risk versus your clot risk determines everything. It's like a high-stakes poker game, and Dr. Jeffrey Tauth emphasizes this isn't a decision you make alone at 2 a.m. while Googling symptoms. Let me share what happened to one of my patients. We'll call her Maria. This 65-year-old had been taking aspirin for 10 years religiously. No heart problems, just prevention. But she started having stomach pain that was making her miserable. We calculated her actual heart attack risk was only 2% over 10 years. 2%. That's like worrying about getting struck by lightning while you're standing in your kitchen. We stopped the aspirin, her stomach healed beautifully, and we focused on diet and exercise instead. She's doing fantastic, and her stomach isn't staging a daily rebellion anymore. Yep, entirely true. The pharmaceutical industry isn't exactly thrilled about this revelation, but science doesn't care about hurt feelings. We learned that aspirin works like a blood thinner. It prevents clots but makes you bleed more easily. For someone who's already had a heart attack, that trade-off makes perfect sense. Their clot risk is sky high. But for healthy people, it's like wearing a life jacket in the bathtub, unnecessary and potentially problematic. So what should you do? First, never start or stop aspirin without consulting your doctor first. If you're doing this solo, maybe I should see you in the clinic. We need to talk. Your age, bleeding history, and cardiovascular risk must all be weighed together like ingredients in a recipe. Blood tests and risk calculators help determine your personal benefit. Many people do better with lifestyle changes than daily medication, and that's actually exciting news. Think of your heart health like managing a garden. Some people need the heavy-duty fertilizer. That's our high-risk patients who benefit from aspirin. Others just need good soil, water, and sunshine. That's diet, exercise, and stress management. We were putting fertilizer on every single plant, and some were getting burned. The new rules are actually pretty straightforward. If you're currently taking daily aspirin and you haven't had a heart attack or stroke, you need to have this conversation with your doctor. If you're over 60 and started aspirin just for prevention, you especially need this chat. And if you're having any stomach issues, unusual bruising, or bleeding, that's your body waving a red flag at you. Here's your action plan. Schedule an appointment this week to review your aspirin use with your doctor. Bring a list of any stomach issues, bruising, or bleeding you've noticed. Don't just stop taking it cold turkey, but don't assume you should continue either. Your doctor needs to look at your complete picture, not just follow some outdated playbook. The bottom line is this: medicine evolves, and that's a good thing. We're getting smarter about personalized care instead of cookie-cutter recommendations. Your heart deserves a tailored approach, not a one-size-fits-all solution that might not fit at all. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy. And remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.